Hi, my name is Aliyah. I'm a chartered physiotherapist from Resync Physiotherapy, and today I'm going to be doing a presentation on lower back pain. It's extremely common, it's something that should be talked about, so I just have put together a few slides to go through. Perfect. So some of you might have the question of what is lower back pain. So it's defined as pain between the buttock and the lower edge of the rib cage. It can be specialised or generalised, and it's basically any pain that is brought on by a specific condition, a structural issue with the spine, or when the pain radiates from another area of the body that can be referred to as specific lower back pain. It can be acute, subacute, or chronic, lasting for varying amounts of time. And when it's impossible to pinpoint a particular disease or structural cause for the pain, it's said to be non-specific. And 90% of the time, lower back pain is non-specific. So the incidence, it's extremely common. So 690 million people worldwide in 2020 had lower back pain. It's predicted that the number would rise to 843 million instances by 2050, mostly due to population growth and aging. It's the leading cause of disability worldwide and the condition that most number of people will benefit from undergoing rehab. So physio is the first option according to the NICE guidelines in 2020. It affects women more, and people from any age can have lower back pain, but most people do at least once in their lifetime. The most prevalent ages are between 50 and 55 due to degeneration and narrowing. So yeah, moving on. So this is just a graph taken from the Lancet study, just going through how the incidence differs between males and females. As you can see, the females are in purple, so they have a higher incidence rate per 100,000 people, and this obviously increases with age, and males will have a lower incidence rate, but of course it'll increase with age. This is just another one to highlight that. So the kind of lower back pain can limit a person's mobility, which obviously has an impact on their participation in their job, education, and in their community. So it can also result in poor mood, discomfort, and sleep issues. So as I mentioned before, it can be acute, so that means it lasts less than 6 weeks. Subacute, 6 to 12 weeks, or chronic, which is lasting more than 12 weeks. So in the majority of acute lower back pain instances, symptoms resolve on their own, and most patients will make a full recovery. Some individuals, however, will continue to experience the symptoms and develop chronic pain. So the first symptom that can be with lower back pain is sciatica. So a lot of people have probably heard of this. It's caused by compression of the sciatic nerve and can be due to inflammation of the piriformis, which is a muscle in your glutes, and your obturator muscles as well, which compress the sciatic nerve. So having sciatica means you can experience mild to severe pain anywhere with nerves that connect to the sciatic nerve. So mainly it affects lower back, hips, buttocks, or legs, and some symptoms may even extend down into the feet and toes depending on the specific nerve affected. And sciatica can also be disc-related. So radicular pain, then, there are several causes of spinal compression. So this is basically derived from nerve root compression in spine being pinched or damaged. So this can be herniated disc, stenosis, diabetes, nerve root injuries, and scar tissue from spinal surgery as well. So this can also cause pins and needles, numbness, and weakness. So physio can help confirm that you have radicular pain and rule out other conditions that require additional testing and treatment. So once a diagnosis of radicular pain is confirmed, they can help you decide how to manage it. So it's widely recommended that people with radicular pain have conservative treatment for 6 weeks before they consider other kind of treatments or tests. So your options might include self-management techniques, education, exercises of course, or a combination of these. So facet joint pain then, basically common symptoms of this include muscle spasms which pull the spine out of alignment, causing back pain. So the facet joints are synovial joints, so they're in your spine. They help basically support the spine and control movement between each vertebrae. So they work together with the discs to enable the spine to move. So the usual acute attack of back pain involving facet joints occurs suddenly without any warning. And it can arise directly from the facet joint, either from inflammation or nerve impingement. So this spasm of like the adjacent muscles is the body's way of protecting the area and tries to prevent you from moving and incurring more damage. So often patients report just bending over to tie a shoelace, for example, and then suddenly being unable to move. So symptoms can vary greatly and be confused with disc-related disorders, as it's possible for patients to report referred pain into the lower extremities as well. So the next one is disc degeneration. So this is an age-related condition, causes pain in the legs, thighs, buttocks, lower back, severe pain when sitting, and may feel better with walking, and worsens with twisting and bending. So this is due to the drying out of the discs over time, making the discs lose their support and function. It can also be caused by an injury or overuse due to repetitive activities or sports. There are risk factors. These include family history of musculoskeletal disorders, strain on lumbar discs due to wrong sitting posture for a long period, so desk job, obesity, smoking, those kind of things. So the next one is osteoarthritis. So it's the most common form of arthritis affecting millions worldwide. So this can occur anywhere along the spine, but usually it's lower back. So this happens when cartilage within the bone begins to wear down. So it can cause pain, stiffness, swelling, and loss of mobility. So when you move and there's no cartilage, the bones will then rub together painfully. And spurs form in the joints, which are kind of bony growths, and these can press on the nerves, causing more pain as well. Symptoms of back osteoarthritis usually start slowly and get worse as time goes on. So osteoporosis then, there's usually no symptoms in the early stages. So the later stages is when you have that kind of stooped posture, and the pain is usually associated with fractures. So osteoporosis is a condition where the strength of the bones weaken, making them more susceptible to fractures. So this is when the pain will come on, and obviously the location of the pain depends on the location of the fracture. So treatment for lower back pain depends on the type of pain and whether it's non-specific or specific. So of course, physio, psychological and social support and lifestyle changes are all involved in this. So for specific lower back pain, the treatments kind of focus on treating the underlying condition causing the pain. So this is determined by MRI. And then physio at Resync, we offer combination therapy. So this would include exercise, manual therapy, acupuncture or dry needling, massage, and manipulations. So basically, as you can see on the top part, that's the pain scale. Okay, so this is described using numbers or happy and sad faces. So if your pain is below a 4, this is considered to be tolerable and should resolve with movement and physio. If it's above 4, it may be advised to take paracetamol or Nurofen if you've taken it before, but pain levels that are constant, kind of 6, 7, that's abnormal and should be assessed by a professional. So of course the first line of treatment for non-specific lower back pain is physio, but in terms of kind of what a GP does versus a physio, so the GP obviously deals with illnesses and conditions and can help kind of diagnose those things, whereas physios have like an expertise in pain, so we'd be able to help you with this. Okay, so the importance of physio then. So of course, pain management, physios can aid with a number of modalities, so manual therapy, heat, cold, and exercise prescription. So all of these will help with your pain, as well as education. Improve function, so we can restore and improve the function of the lower back and the surrounding muscles, and this can help kind of individuals regain their ability to perform activities and work. So individualized treatment plans. So this is crucial. Not everyone's the same. So we kind of make these based on the specific needs and condition of each patient. And then of course posture. So poor posture can be a contributor to lower back pain. So physios can assess and correct postural issues, helping patients develop better body mechanics to reduce strain on the lower back. So then we have strengthening, of course, huge one. So this includes exercise and stretches that target the muscles and structures in the lower back. Not only the lower back, so we'll see where the weaknesses are, whether it's glutes, core, and then we can target that and start to strengthen them as well. So this reduces the risk of future pain. Education and prevention, another huge one for lower back pain. So physios can educate patients about the importance of proper body mechanics, ergonomics, lifestyle modifications to prevent future episodes of lower back pain. And they can also provide guidance on exercises and self-care techniques to manage and prevent pain as well. Then we have a non-invasive approach. So it just basically means it doesn't involve surgery or medications. Basically, it's a safe and effective choice for many individuals with lower back pain. Then we avoid reoccurrence. So, like I said, addressing those weaknesses, strengthening them. We just address the root cause of the lower back pain, and we provide patients with the tools to maintain their spinal health, which in turn reduces the likelihood. And then enhanced quality of life, of course, this is a huge one, especially with patients with chronic lower back pain. They can have significant problems with mood, and of course that's going to affect your daily life. So physios can obviously help improve overall well-being by reducing the pain and increasing your function, getting people back to the things that they love doing. So just a quick summary. Physio is a valuable and effective approach for the treatment of lower back pain, which I've explained. We focus on pain management, education, improving function, offering kind of a holistic approach to enhancing a patient's quality of life. And individuals experiencing lower back pain should obviously consult with a physio to receive a thorough assessment and tailored treatment plan. And we can help you figure out the next steps and, you know, give you guidance and reassurance as well, which is a huge thing. But I've just included some references as well. But yeah.